Okay, we are live. Thank you, Fiona. So we will we'll get started here in a couple of minutes, and just want to make sure, Fiona, you want to pop our first slide up just so that that's there we go. So people know who we are.
What do you like this one?
Everything good?
Do you like this one or the other one? First.
Why don't we leave it there? That way it's easier. So Dr. Kat, do you know much about our business? Have you had a chance to get up to speed with who we are and what we're doing? Oh, we lost you.
Muted.
I think you're muted.
Sorry, I forgot we were starting and I muted myself. So I have roughly an idea of what you do, but I haven't looked into you in depth.
No problem. Well, it'll be fun to get to know what you do. And we primarily serve people from North America, so the United States and Canada, but then English-speaking clients from all over the world. We have a smattering from Malaysia to England, and everywhere in between. But it'll be really interesting because as I've been talking about this coming up to people, they just are like, what? Wait, I didn't know. I thought it was like Turkey or Mexico. So I think it'll be really fun to introduce another kind of angle to folks from Portugal. So I'm looking forward to it. I'm excited.
I love this component of this too, Colleen, because dental, sometimes it can take longer. It could take 2 weeks or more if they're having extensive work done. Whereas facial with Dr. Catarina, that could be much quicker timeline for touch-ups.
It was funny. I was telling our team what we were doing. And of course, our team is pictured here in the photo and everything. And they were like, wait, can we do it? And I was like, yes.
Yes. I just got this done. Mimi's getting it done. It's like, we love Dr. Catarina.
It is not limited to just people coming in as our guests.
Obviously.
So it was funny because I was talking about being on this, and this morning I was looking in like the close-up mirror going, oh no, I'm going to be on a call. She's going to
No, don't worry. Do not worry about this.
It's funny though. I don't know if you guys do this, like while we're waiting, like if you're on Zoom or these calls, it's hard not to like look at yourself and start to be like, oh, why is my eyebrow here? Or is my nose crooked? Like, I don't know.
Yeah. The more you spend time looking at yourself, it's better to stop. It's better to stop at some point. Otherwise you will see things you don't want to see.
Exactly. No, it's a weird sensation to just start being like, oh, but what about this? And oh, look at that. So it's I do that. I try now to put myself out of the main place, but at the same time, I have to be like where it's in the center, or else it looks like I'm constantly looking away. So it's that kind of balance between both. But so Dr. Kat, you're in Lisbon too, right?
Yes.
How long have you been in Lisbon?
Since my birth.
Really? Oh, wow. I don't that's like a local Lisbon person.
Yeah.
Maybe ever. So
I am a local. Yeah, I'm born and I'm what they call alfacinha. You know that term?
I don't think so.
Oh.
Yeah, it's translates to little lettuce. I have no idea why so someone that is from Lisbon, that's the name they give you.
Little lettuce.
Little lettuce, alfacinha.
Did you go to school then in Lisbon and everything? It's always
it's always been Lisbon.
That's cool. That's really cool. Well, I will. I love Lisbon. When we first came to Portugal the first time in 2019, we came with very limited expectations. We traveled like the rest of Europe and never really made it to Portugal, and I had some mileage to burn. So I was like, let's go to Portugal. Let's go to Lisbon. And then it was like, wait, how have we not been here? This is an amazing place. And it just captured our imagination. And now, 5 years later, here we are. And living in Portugal. But I'm not a big city girl. I don't know. It's tough for me I like a little smaller town, but love visiting. Okay, so our guest, Sandy, Dr. Little Lettuce, you just hello, Sandy.
That's funny, Sandy.
Now forever with our people, you'll be known as Dr. Little Lettuce.
Little Lettuce. That's good. I'm healthy and light, so that's perfect.
That's great. That's a good way to describe it. I'm really curious. Does lettuce have something to do with Lisbon?
I honestly don't know the story of it. I'm sure there is some sort of story to it, but I've never looked it up. Maybe
That's
the
so
mystery is what
important.
makes it more fun.
Yeah, yeah, for sure, for sure. Well, we're just going to give a couple more minutes just to make sure folks have a chance to get signed on, and then we'll get started. So we'll be settling in here soon. But yeah, I like that. What now, Julien? We need a nickname for you from Lisbon. So
Oh no, I'm still New York. I can't shake the New York yet. I'm trying.
you know, you've got that New York vibe, though. You know, get it done, get in, and make it
Well,
happen.
so do you. We really click with that. We're like business. It's that. Yeah,
Yeah.
get it done yesterday.
It's just funny because you're New York and you like Harry. I'm like West Coast. Hey Lou, hi, welcome.
Hi.
I'm like West Coast girl from Oregon, but people always are like, "You're from Oregon." I feel like you're way more East Coast. So maybe that's why Portugal works. So
Yes.
so it's really good.
Nice.
All right. So we are again just getting people signed on and everything. So we'll just give them another minute or so. And of course, I don't know if now it's just dark now. So maybe the people are coming off the waves in Nazaré. We had a crazy day up here today. There were tons of people that were out in Nazaré. The place was packed. There's the big tournament. So Sandy, I think you can give a thumbs up. Sandy, did you go to Nazaré today? Yes, no, yet. Just going to comment. But I know there was a bunch of people from Alcobaça that were headed over. It's only 10 minutes from here, so it's easy to run over to Nazaré. Dr. Kat, have you been to Alcobaça? Do you know the area up here?
Yes, I do. Although not really the Nazaré part, because I'm not a very surfer person. Definitely not in this weather.
No. Oh, Sandy's saying, and they were awesome waves today. So that is what I have been seeing as well. It's been all over the news, so it's pretty cool. Tons of people. All right. So should we get started? Do we want to get started, and then we'll just pick people up through?
Sure.
All right, so I am so excited that we are having this webinar today. This is our first webinar of 2024 with just excited to kick it off. We've been wanting to do this for a while. I am Colleen and I'm with Portugal the Place, and we are a company that is all about making a soft landing for folks that are looking to relocate to Portugal. So we work with everyone from helping them find the location to a rental, a purchase. We have an ajuda service, which is basically all the help you need from translation to helping you navigate websites, all the things that kind of fall through the cracks and you don't know what you don't know. We're here to help you with that. And part of that is making sure people have access to information and learning about new opportunities, which brings us to today's webinar. So we are really excited to have Julien here with Dental Destinations, and she is going to help us get to know about all types of opportunities within dental tourism and aesthetic medicine. And she has a guest here that she's brought to help share what they do. So Julien, I'm going to turn it over to you and let's get started.
Great. Hey, Colleen, thank you so much for having us. Really appreciate it. And I wish you were here when I moved here a few years ago, because I could have used these services. It's really hard to navigate, and to have someone like yourself is really amazing. So yeah, I hope people take advantage and access your knowledge and all your help, because it's so worth it. And so what we do at Dental Destinations Portugal, I can speak a little bit more about that on the back end, because I don't want to take away from our wonderful guest here, which is Dr. Catarina Cardoso. She is one of our amazing dental doctors that we work with. And tonight we're going to be talking about facial aesthetics, which is something that's very different, I think, for people when they come here, especially from the US. You would not think of going to a dentist to have filler done or Botox or some of the facial things. So it really was kind of a mindset I had to look more into and find out about. And we are so lucky to have her as one of our team members, because she does an amazing job, and you'll find that to be true in Portugal. So I want to go ahead and introduce Dr. Catarina. And Catarina, thank you. Welcome. Thank you for your time and being here today. I'm going to put my eyes on, because I will be doing the slides for today. And I will go ahead and just let you take over. Let's see, Fiona, I am not seeing the ability to access my slides to change them. Here we go. Or there we go. Okay, Catarina, take it away.
All right. Thank you so much for the kind introduction. My name is Dr. Catarina Cardoso. You can call me Dr. Cat or maybe Dr. Little Lettuce. I will respond to that as well. And I am a dentist, or as we would call it in Portugal, a dental doctor. It translates literally to médico, doctor, dentista, dental or dentist. So we are doctors, and as I will explain to you further. So what will we talk about today? Facial aesthetics in dental practices, creating a harmonious appearance with your smile. How are we qualified to do this? Our education, regulations, what procedures do we offer? Common procedures, prices, and what to expect. And obviously, if you have any questions at the end, I'm happy to answer them.
That's fantastic. Thank you for being here again. We're really excited about this.
Okay, there we go.
Okay. So, it is not uncommon to find dental doctors performing facial aesthetics in Portugal. Why is this? We can skip over to the next slide to find out. So, it's really, if you think about it, your smile, as I was saying previously, your smile is not just a combination of 32 of your teeth in your mouth. Your smile is way more. Your smile is bone, is teeth, but it's also muscle, skin, ligaments, the whole face. So you cannot detach one thing from the other. And as medicine has, evolved over the years, we have this more, well, way back in time, everything was the same thing. And then we started to segment and specialize and hyper specialize. But then we started gradually to look back again and integrate all of these parts together. So it makes sense to, when you look at the smile and at the teeth and the mouth area, the masticatory system, that you can't just separate all of these items and treat them separately without considering the whole. And as a dental doctor specialized more in dental aesthetics, I started noticing that just fixing the teeth is not creating a beautiful, harmonious smile. I need more. The patient needs more. Right? So this is why it makes sense. And just as a side note, Portugal is not the only country where this exists. Brazil is one of the biggest, I would say, how do you say, impulse? One of the biggest impulses for this to exist. Also, the UK, Italy, and many other countries. So we are not the only ones with this practice. Next slide, please. So why does it make sense that we do this? So we work here all day, every day. This is our area of expertise. We do surgery, small surgeries, all day, every day. We deal with your skin, with your face, the way you smile, the way you chew, the way you eat, everything. We're used to that, and we are used to seeing all of the signs, and we already have, obviously all the back knowledge of physiology, head and neck anatomy that is very, very specialized in our case as dentists. And obviously pain management. We are pros at controlling your pain and making the best of your dental experience. As we know, there's a trauma from the past, and we are doing absolutely everything we can to get rid of that notion. And we want to make it absolutely as pain-free as possible and make your recovery easy. So in terms of education, I have a master's degree. All dental doctors are required to have a master's degree now to finish their education. After that, I also did another postgrad, how do you say, for teaching, for being able to teach other students as well. So I did a postgrad of that. And then I did multiple postgrads, obviously on facial aesthetics, both in Portugal and abroad, in Spain and in the UK, mostly. So every year I'm going to courses, I'm going to congresses, meetings, all of that stuff to keep updated with everything that's good and new, as it's ever evolving. In terms of safety, obviously, we are doctors, okay? So this is not, I know that many countries, and even in Portugal, we are fighting against that because it is a health hazard to have this type of procedure done by non-healthcare professionals. And this is not a cosmetic procedure. This is a treatment. This is a medical treatment that can go very wrong and have very serious consequences if not done properly and done in a safe environment. So it definitely has to be done by someone who has the tools and the equipment to make it as safe as possible for you. So we are dental doctors. We're doing this in a dental practice with all of the required, protocols and licenses and all of that. Obviously, we have this. And what else was I going to say about this that I completely just forgot? Oh, obviously, in terms of products and materials that we use, everything is EU regulated, so we cannot use products that are not in compliance to EU regulations. And I don't know if you know this, but EU regulations are way more strict than, let's say, the FDA. So you are in good hands, and we only use the best of the best products. So very safe in that regard as well. So after all of this talk about how safe it is and it's okay to do this and it makes sense to do this, what are we talking about? What can we actually do to give you a more beautiful smile? So Botox, or botulinum toxin, as everybody knows Botox, but there's other brands. We could do dermal fillers with hyaluronic acid. We could do microneedling treatments, light peels, and combination of these treatments. We can do threads. We can do injectable biostimulators that I will explain a little bit more in depth later, that you maybe have not heard this term before. We also do non-surgical fat reduction and obviously skin boosters. Who is a good candidate for facial harmonization or facial aesthetics? Anyone. Anyone can be a good candidate. It depends on what you need, on what you want, and there really isn't an age or a time to start doing this. It's really about taking care of yourself and taking care of your health in every layer of your face, from the bone and the teeth up to the most superficial layer of your skin. So guys and gals, both can do this. So onto the treatments. Botox. So we do Botox, both just the aesthetic and the TMJ and therapeutic Botox. So we can do whichever you need and or prefer. We can do the smile, the gummy smile. We can do these muscles, obviously the ones we all know about, the glabella and the frown lines and all that. But obviously we can do Botox for therapeutic reasons, for, let's say, migraines, headaches. We can do it for the TMJ. So if you grind your teeth, or you clench, or you have some sort of other type of disorder that can be related to your teeth. So let's say you're doing a full mouth rehabilitation, it could be beneficial to you to do this procedure as well. And this is the pricing. So it starts at $330 per session. Really depends on what you need. But this is the usual price. Dermal fillers. We use hyaluronic acid. It's a resorbable product. So we're not injecting anything that will stay in your body forever. No silicones, no crazy stuff like that. So it's really based on a molecule that exists in your skin, and we're just using it to give it a boost and give it back what it has lost. So we're talking about everything from, we can do a little bit of lips hydration, or we can give you a little bit of definition, a little plumping. We can take care of areas where you've lost some volume. Usually a very common treatment that gives you a supernatural but refreshed look is doing the tear troughs or the mid cheeks, as we age, and this is normal. We have these fat pads here, the nice little cheek, and they start to decrease, deflate, and they start going down. It's normal. At the same time, at a deeper level, at the bone level, your bone is also resorbing. So we start getting less and less support, and that's why as time goes by, it looks like your face is melting. So when we restore the volume that you've lost in this area and the hydration, you will get a more youthful and more rested appearance. We're not changing your face. We're not giving you, a crazy, exaggerated look. That is not the key here. It's really just to give back what you've lost. The same thing goes for your temples or the perioral area, this area here, even the jawline. As we age, the jawline starts to get less and less defined and more curvy. We can improve all of this. Microneedling. So now we're talking about the most superficial aspect of your face. So we're talking about the skin itself, and it is important to treat it as well. We don't want to just replenish volume, but we also want to make sure that it's nice and luminous, shiny, with no open pores, to reduce also melasma, so spots or areas of discoloration on your skin. Even acne, we can do protocols with peeling and microneedling together, and they will improve the most superficial aspect of your skin. This type of treatment, it is recommended that you do it a couple of sessions, 2 weeks apart. I would say 3 to 5 sessions, really depends on what you need. The other treatments I was talking about, you can come in one day and do almost everything if you like. This is a continuation treatment because we are doing something that is helping your skin get better. It's like a medicine to your skin. It's a boost to improve the activity of your cells to produce more collagen, and this will happen over time. That's why we need to do a couple of sessions, and over time you will see the results. Threads. We do both kinds of threads. The simple threads that are the ones pictured here are just, let's say, the threads are made of the material of sutures. So, any sort of surgery that they do, surgery inside of your body, that suture also is absorbed by your own body. That's the same thing. But on that line, collagen will form. A strand of collagen will form. And that's how you get, more skin tightening and rejuvenation. We do those simple threads, which you can do anywhere in your face. You can do in your cheeks if you have a little sagging. You can even do in this area, in the tear trough area. You can do in the forehead. You can do neck. It's great. It's especially good for the sagging of the neck, this area. And the other threads, so these are not pictured here, as I was saying, I'm sorry. And they are a different pricing. They're considerably less, but they don't have what the other threads do, which is the lifting effect. So the ones that are the $750 per treatment, they do a mini lift. So they are able to give all of this sagging skin a little bit of a lift. So it is adequate for someone who doesn't have obviously very accentuated sagging. That would be a candidate for a surgical facelift. But if you have just initial signs of this and you would like to prevent it from going further, it is a very good way to help you give you a more youthful appearance. The injectable biostimulators. I don't know if you've ever heard of Sculptra or Radies. I think these names are suddenly very popular on Instagram and on social media. And they're a substance that will, when we inject it in your skin, it will create a scaffolding for the collagen to start being produced and deposited by your cells. So it's also stimulating your own body to make your skin more firm and more dense and more beautiful. But we are not doing it in the surface, we're doing it within. And this also requires, ideally, for you to do 2 to 3 sessions a month apart, and the pricing starts here. This is a very good treatment for everyone. Starting at age 30, for example, our collagen production starts to plummet. So it's a very good treatment that has very lasting results. Up to 2 years, you do a couple of treatments, and up to 2 years, you have the result. And lastly, the skin boosters. The pricing starts at $220. They're a combination of vitamins and other the stimulating agents for your fibroblasts mixed with hyaluronic acid. So they're perfect to give you some hydration if you don't want anything specific. You don't need any specific volume, but you like to get a better looking skin. This is a good treatment for you. Lastly, non-surgical fat reduction, something that many of us are not happy with. Even when you're working out, you lose weight. It's just your bone structure and your ligament structure that you always end up having a little bit of a pouch here. Sometimes it's a combination of fat and also a little bit of laxity, skin laxity, sagging. But most of the times it is that very annoying little fat that keeps collecting in that area that no matter how much dieting you do, it will never go away. So that's why we need to do precise injections in this area that will help reduce this stubborn fat and will give you a more defined jawline. Do we have any more? I think we have one last.
Did Julien freeze, or is she?
I'm not sure if I'm frozen.
There you go. There we go. I was like, you looked very intense for a moment.
Who froze? One of us froze. I wasn't sure. So thank you, whoever pushed the slide for me. Probably Fiona. Thank you.
So questions. I actually have I have a couple of them. If I can start, Fiona, do we have any that we need to jump in with, or should I go ahead and shoot? So when I'm looking at all of these different treatments, the first thing that comes to mind is if you start doing something like a Botox treatment or the filler that isn't needing multiple sessions right away, once you start, are you committed then, and do you need to consider doing it for the rest of your life, or is it like something you do once in a while?
I mean, this is definitely something you do once in a while. It's just like taking care of yourself. It's, it's not a treatment you have to do over and over again. So let's say Botox is one of the treatments that you do need to do it. I propose every 6 months to stay natural, but to keep a good result. Some people will tell you 4 months. Some people will tell you 3 months. I personally prefer to keep you looking more natural, because as time goes by, if you do too much Botox, you will start having a look.
Yeah, right? We've seen that look. Right?
Yeah, so to keep it light, to keep it beautiful, for me, natural is the most beautiful. I would say every 6 months, just do your Botox touch up. Because also something that most people don't realize, Botox is a toxin. Botox is a medicine. So we're not supposed to do too much of it. Your body can create antibodies against Botox. So if you do too much of it, maybe it will even stop working. And this is real. It's something that does exist. And when people do it too much and too much, you can start having resistance to the Botox. And then no matter how much more you spend, and it will not work. So definitely less is more with this type of treatment. In terms of the filler, it can last very long depending on the area of the face, because we have different fillers for different areas of your face and for different end results that we want. So obviously we will use, a stiffer filler for the cheek, and usually we use a very good brand, Filmed. I don't know if you know it, but in my experience, cheek filler can last sometimes 2 years, and we don't need to do a touch up. But let's say you want to do a more mobile area of your face or the lips, we obviously can use a very stiff filler, or it will look strange. So you have to use something softer, and that will disappear a little bit faster. But I would say 6 months to a year. It depends, obviously, also on the way your body reacts to it.
Well, it looks like Lou definitely found where they need to get the threads done, which what do we have here as a question? The PDO threads?
The PDO threads, I don't know if you're talking about the lifting ones, the mini lifting ones, or the simple. The lifting ones, we do it as a treatment. So it's a package. We do a set of defined threads for your needs, and that's the package. The other ones, we do per area.
Great.
I want to bring up a point that Dr. Catarina mentioned. She mentioned that they do things more natural, which I think is a big difference I've noticed here in Europe versus America. And I love that. They don't overdo with the filler and the duck lips, and they're looking like some sort of caricature of yourself. They do have a more natural look here, and our clients that have gone to Dr. Catarina have been very happy and also have felt very safe. I've experienced this myself firsthand because I can't promote dentists and things that we're going to talk about that I haven't experienced firsthand. And so I was a big chicken. And when I went to Dr. Catarina, I was so appreciative and overwhelmed by how much of a medical aspect they provide to these treatments, more so than anything I've experienced when I was in New York. So I had asked her, I said, I'm a chicken, I'm afraid of needles. Can you tell me about when you do the filler with the needles? And Dr. Cat, you take it away from there.
Yeah, definitely. Because I'm a chicken too. Just looking at the slides, I got a little squirmish. So.
Yeah, don't worry. So I know it all looks a little bit scary, but also I can tell you I have done it to myself as well. I have almost 10 years working as a doctor. I know it doesn't look like it. Thank you. I will give myself the compliment, but also I do for myself as well. And that is the secret, is to, do a little bit of this and that early on, and it will definitely last longer. But anyway, going back to the safety. So this is a medical procedure. This is not a cosmetic procedure. We're putting stuff in your inside of your body. And obviously, if you were using sharp needles, we can perforate a nerve, we can perforate an artery, we can clog an artery, and that can have very serious consequences for you, such as, I don't want to scare you, but it's important to know what you're getting into. You can go blind from a filler placed in an artery. You can lose half of your face. You can have necrosis. So you can have facial paralysis for the rest of your life. And so these are not things to do lightly,
Right.
We actually, let me just add, so to minimize many of these issues, we use something that's called a microcannula or a cannula, which is a blunt object. So all we do is we use the needle for very, very specific treatments that are almost risk-free of doing with the needle, and everything else that's a little bit more risky of having these side effects, we use the cannula. So we just do an entry point with the needle, and then everything else we do with a blunt instrument. So no matter where we go to, it will not perforate your arteries, it will not damage your nerves, it will not do anything at all. And also, it's a pretty painless, strangely, it's a pretty painless procedure. You feel something, it's strange the first time you feel it, but you don't really feel pain.
That's really helpful. I think one of the reasons I wanted to have you on is because, at least for us on the West Coast where we were at, there was starting to be a lot of these things like Botox parties and people doing things outside of a medical facility. And it would really scare me. And I'd have friends that were like, hey, come do this. I was like, no, I'm not. No, that just seems like not a good idea. So hearing about the safety and the protocols and what's involved, I think is really important, because it seems like people have gotten kind of casual with some of it.
Yeah, exactly. That's one thing. I don't want to scare my patients, but I want them to know what is at stake. It is important. And if you come to my appointment, you will have a sheet of paper with information and with all of these things that can happen. And even if we do everything up to protocol, our bodies are not the same. Everyone's different. So there's this anatomy, but there's variations. This is not maths. This is the human body. So even if we do everything up to protocol, we can still have undesired effects. I'm not saying, the scary ones, but we can still have undesired effects. So it's important to know about this and to go to a medical professional that will help you fix whatever that may occur afterwards, because it's not just doing it right at the moment. It's also dealing with what may come.
So
and we are obviously prepared to do this.
Exactly. If something goes wrong, you can help out because you have that doctor background. I want to reinforce that again with the dentists in the US. They don't have 3 years of medical training. So if you're going to medical school, the dental doctors have the same first 3 years. And in Europe here, they are required by law. If there's an emergency and there isn't a medical doctor around, they have to jump in and help. So yeah, if you're choking on that chicken bone and need a tracheotomy, Dr. Cat can help you.
Yeah, I mean, that is interesting that you say that. Obviously, I did not do any tracheotomies in my life, obviously, because that's not my, but I theoretically learned how to do it. And unfortunately or fortunately, by law, I am required to save you. If there's a car crash, I am required to do everything in my power to save you. I cannot just drive by. I cannot just call, the emergency. I have to do everything in my power. So obviously, this is my area of expertise. And if you ask me, oh, but can't you do, my booty? obviously I will say I definitely could, but I won't because it's not
Right.
my area of expertise. Just like you would not ask me for a heart exam, could I do it? Yes. Is it ethical? Not really.
Well, I like the crossover with this conversation over some of the things that these treatments can help with, and
Mhm.
taking it to that medical, like the TMJ, or grinding your teeth and the headaches and things like that. Because I do think sometimes people feel like there's a stigma attached, maybe, to getting what they call
Yes.
cosmetic procedures. But then when you brought right out in the beginning, if you've got some of these situations, this can actually be used to help you feel better, right? To help you
Yeah.
actually improve
And
it.
not even just as like direct aspect of a therapeutic result, just a TMJ or anything, but there are many articles talking about this. Botox, for example, which is the most studied one, has direct correlation to improvement of depression, improving quality of life. Because, as I like to say, as you say, when you look good, you feel good, and when you
Right.
feel good, you play good, or that's from the sports, but your life improves. So it is very important to feel good in your skin, and I don't see why you would get the most beautiful teeth you could get, beautiful veneers, beautiful porcelain, and then everything around it just brings you back down. It doesn't make sense to rejuvenate one layer and then have all the other layers completely left untouched.
Well, and I think, just to kind of wrapping this up, because I know we'll also be speaking about your dental practices and what you offer for dental tourism in our next webinar this evening. But just in case, I wanted to stress too that my experience in Portugal, and one of the reasons that I actually even can manage the concept of dental work or anything, is have that massive phobia of dentists. Just walking into a dental office causes my blood pressure to go up, the anxiety levels to go up. There's just so much trauma, and so many Americans that I know have come off of
Mhm.
massive trauma from the dentists. And I'm correct in understanding that when you went to school, they talked about that here in Portugal, that's something that you consider? I thought perhaps expanding a little bit on the mental part of it is really important.
Yeah, I mean, obviously, people have this stigma also here in Portugal as well. Not the younger people so much, thankfully, because we've made this change. But I would say people from 35 and up are almost always very scared of the dentist. So we do take into consideration, at least for me, at least me personally, I can't speak for all of my colleagues. I do think it's like that. But for me, I feel like when the patient comes into my appointment, I want them to feel like they're at the spa. So I want them to feel relaxed, safe, like they're doing something good for their health. They're not going to feel any pain. They're not going to feel anxiety. They're just going to lay there and possibly even take a nap, which some do, which some do. So that is my goal, to give you the best experience and to make you feel good about your oral health, about your face, about your overall health. That's what I want you to feel.
That's fantastic. Do we have any other questions, Fiona? Did we see anything that we didn't touch on?
I have one thing, because this came up recently. It's not just women we're talking here. Catarina also sees a lot of men, and I know some of them might be a little hesitant to go to somewhere where they're getting facial work done, but they have the guise of going to the dentist.
Yeah,
And I
that's
think-
also something that people like about this, because most people still don't like to talk about, getting facial treatments done. So they can always say, oh, I'm just going to the dentist for this procedure or that procedure. And that's a way that you can do whatever you feel like doing, especially the guys, without having to specifically tell anyone that you did some sort of aesthetic procedure. So that's a good plus for some
That
people.
is a good plus. Thank you, Lou. That's a really good point about making sure that you're educated. I just can't imagine, if you're going to do anything physically, that you're going to take into your body, or that it has that medical element, doing it with anyone less than the most trained and trusted professional. Just like you wouldn't trust your taxes to your mechanic.
Obviously.
You want to have those professionals. So I really appreciate you bringing that forward. Now, you're located in Lisbon. Dr. Kat, can you tell us a little bit of, you have just yourself, or are there multiple people in your office? How does it work to get an appointment, that type of thing?
I'll jump in too on that. That's where we come in.
Yeah.
Kat, I'll let you off the hook on this one. We want to make it easy for our international clients, whether they're coming here for scouting with you or maybe they're not even scouting. They just want to come to Portugal and have dental work done or facial aesthetics. We take that stress away from that and help because we've already vetted our dental clinics, and Dr. Kat is part of one of 3 wonderful clinics we're working with in Lisbon. We are opening at Porto soon. So we facilitate for them. The doctors are so busy, they don't have time to always be dealing with international questions, but we're also working with expats as well. So we'll facilitate that and make it easy and make your first introduction, and they can set up the appointment. Based on what information you provide us, we'll find out who the best clinic is for your needs, whether it's dental implants or facial or what have you. So that's where we come in to make it just a one-stop shop. So you don't have to stress out and worry, am I going to a good clinic? Am I going to a qualified dentist? Do they speak English? Does the reception speak English? Because that's a big part of it too.
Right.
And you want responsive people that get back to you right away. So we have done all that work. And yes, there's a lot of good dentists here, but you don't always get the full package with being able to deal with communication barriers or time issues, trying to get in quickly. So we eliminate all that. And
how
Dr.
about, to Alyssa's point, she's asking about how far in advance the booking here, how easy it is to get an appointment.
It's fairly easy, I would say, maybe 2-3 weeks. So it's not too crazy, I would say. It really depends. Sometimes it's a bit crazier, it's a bit busier, but it's just like Julien said, just talk to Julien and we will set it up. But yeah, you don't have to do it with too much time in advance. We'll find you a slot.
And we have preferential treatment with our dental clinics we work with. So if we call, they'll find a way usually to squeeze somebody in. So that's another reason too. We had an emergency dental treatment last week from somebody of yours, Colleen, and so we were able to get them right in that afternoon.
That was amazing, and I know really appreciated, because boy, when you're in another country and you don't know what you're doing, that anything to do with emergency dentistry can be just so challenging. So no, I think this is fantastic. And what about if you live in Portugal? What if you're not traveling here? What if you're already
just contact us? We have a form that you can fill out. We kind of help with the legwork already with the dentist. So you just fill it out. There's a specific section on our site that says, if you live in Portugal, fill out this form. That way we have some idea of what to pass on to the dentist. If you have your x-rays and stuff you want to send us, we can just take it all and send it off to them just to make the process a little more streamlined. We'll make that first introduction with via email. Or phone to the clinic director to go ahead and chat with you and set up your first appointments. And then you're off and running with them and you're set and good to go.
Great. And is there a fee for that, Julien? Is there a fee for that?
We work with the dentist. We operate as their international care coordinators, and locally we don't charge somebody a fee. You're not going to get a bill from us.
Okay, so that's really helpful. So if you live here in Portugal or if you're moving here, you just reach out to Dental Destinations for either the aesthetic medicine or the dentistry, and you can coordinate it from there.
Yeah, we're happy to help.
Perfect. And you have social media too. I know you're on Instagram and Facebook, and so they can find you in a variety of different ways.
Exactly. And our website is dentaldestinationsportugal.com. So pretty easy to find us.
Perfect. And we'll be putting that up so we'll be putting this all out on our social media. We'll share this as well, and we'll have all the contact information in there too. So any last questions or anything we should cover before we finish up today? Anyone else have any questions?
Did we miss anything, Dr. Kat?
I think we covered pretty much everything.
Fantastic. Thank you. Thank you. Thank you so much.
Thank you so much for having me as well.
Yeah, I'm excited. We will see you. Thank you so much to everyone that joined us tonight. And we will be back here in just a little bit to dive into the dental side of things. So if you want to come back and join us for more and have some more questions, we'll be back on in just about an hour and 15. So we will see you again soon.
Bye, everyone.
All right. Bye now.